the first thing we do is we see the limb color changes. Okay, as the patient in arterial disease, for example, if the flow of blood to the foot is not proper, it will have initially a pale kind of color, which because of inflammation and stasis can also take a color of a dusky discoloration thing uh, when the inflammation sets in. So that is a typical discoloration. Now you'll say, what is a discoloration? I'm not very good with colors. Always compare with them. If you see a difference in the color of the 2 foot, that means something is happening. Okay, so note this color, and with any one finding, we do not try to make a diagnosis. So keep recording all these things. Ultimately, when we'll compile it and we'll collate all this, we'll have a diagnosis. The second thing which generally happens in ischemic diseases is the skin becomes shiny and hair loss, and there's a loss of hair on the thing. Now, loss of hair is very easy to understand because obviously the supply to the hair follicles is reduced, so that leads to loss of hair. Now, why this shiny skin comes? Because normally shiny things are seen as healthy things, and if intuitively asked, I should answer that ischemia should lead to rough skin rather than a shiny and smooth skin. But here, what happens is in skin, if you see the skin, there's something called as a retipex, which bind the skin to the dermis. Okay, and at the site of these retipex, there's a slight depression on the skin. These forms those lines on your skin. If you see skin closely, you'll see a lot of lines on that, very fine lines. So these are all responsible. These happen because of retipex, and this is why the skin is never smooth. It's never like flat. But because of ischemia, these retipex are destroyed, which leads to a very smooth skin, and these lines are lost, and that causes the skin to be shiny. So shiny skin here is a sign of ischemia. Okay, that's why there's a shiny skin. If the ischemia progresses, we get something like an ulcer. If you can see here, an ulcer is very typical. Okay, and I'll try to revise the ulcer as such here. Now I know you may be knowing, most of you, what ulcer is. Ulcer, whenever there's a mismatch between, let's say, ischemia and the growth of the cells, a part of the tissue is lost, is sloughed off, and it leads to formation of ulcer. Most of the ulcer, when they start, at least non-traumatic ones, are shaped like a punched out kind of ulcer. Okay, now and then after some time the healing starts, and it's just like a pit. If you see in a road like a pit, and you start filling it, and the sign of healing will happen, that it will slowly become like this. It will slowly become like this, and then it will heal up. Okay, but here, because of ischemia, there is no healing happening. Okay, so this is not happening. That's why the ulcer remains like a punched out. Okay, so that is why arterial ulcers are punched out. So if I ask you what are punched out ulcers, arterial ulcers are punched out, as well as the fresh ulcers or new ulcers are punched out. Okay, so those are the neuropathic ulcers can be punched out because there's nothing in healing, but most of their repeated ulcers, so you'll see them at different stages, and some of the ulcers can be punched out. Whereas this ulcer is a healing ulcer because there's sloping edges. No? So it's a sign of varicose vein, or any healing ulcer is a sloping edges. And we'll not cover other things, but the concept is same. If you understand what's happening at the tissue level, you'll be able to imagine the shape of that ulcer. Further increases the supply of muscle, which are more vascular than the skin. They start depleting and compromised, and then muscle wasting leads is the result of that. Further ahead, there's a proper skin loss, and there's gangrene. Okay, so that is the various things which you can see on inspection. So look for color change, look for how the skin is, what the hair distribution is there, look for any ulcers or any wounds, look for scars. If you see a lot of scars on foot, that means patient is being having a lot of traumas, and then various wounds are there. And then look for muscle wasting. How to look for muscle wasting is you measure the limb circumference on both sides at the equal distance from a knee bony prominence. Typically for leg, we say around 8 to 10 centimeters from the tibial tuberosity, and in the thigh, it's at the mid thigh level. So you measure on both limbs. If the difference is more than 1.5 inches, it is significant. Also, then we come to the most important part of any arterial system examination is the palpation, and the pulses. But before that, you can also compare the temperature of both the limbs. Okay, always compare the temperature with back of your hand, back of your fingers from here. Now, why this? Because it is more sensitive than the front. Now you can imagine, you can try testing against a cup of tea or anything hot, and you will see that this is more sensitive to any temperature change. So do it with back of your fingers on both the sides. Okay. So this is what we need to do. And again, if you feel any difference, always try to palpate or touch the normal side first and then go to the abnormal side. Because by touching the normal, you'll have an idea of what normal is, and then you compare the thing. And both the limbs, when you're comparing it, they both should be exposed. Now, for example, what to compare with? If both the limbs are available, then you compare with each other. Now, let's say both the limbs are not available, or you see the disease on both sides. Then from where you compare? Then you have to compare another exposed part of the body. Okay, do not compare the limb temperature with, let's say, abdomen, which is covered, because that obviously will be a little warmer. So both the part have to be exposed for a good amount of time, so that they assume the changes or adjustment according to the exposed air. The second thing which is important is capillary refilling time. So against any bony prominence, you press the skin. Typically, we can do in a finger or in your toes or anywhere, or against the sole or heel, and press it for some seconds and then release it. And you will see that after blanching, it recovers within few seconds. Typically, it should be less than 2 seconds. If it is more than 2 seconds, then it is abnormal. And then pulse examination. So pulse examination is the mainstay, and in examination or otherwise, this is the main part. If you're dealing with a vascular case, I think most of your Viva will be around this, that which arteries have you palpated and what are the various grades. Whenever you're feeling, feel for the rate, feel for the rhythm, the volume, and the symmetry. Okay. Again, there are more other things like which are very students are very fond of, according radial delays and radiofemoral delays. Yes, in some cases it is important, but again, I think you require a great degree of expertise to pick these things. But do not focus on this at the cost of this. So this is more important for us. So if you're able to record and report a rate, rhythm, volume, symmetry very good, I think you'll be okay.